Hi, everybody. Dr. Kogan, GW Center for Integrative Medicine. I want to give an update on our new cognitive assessment test called BOCA Test. One of the reasons I want to discuss this is not just to show you the evidence of its use, but also the fact that we are transitioning almost all of our patients with cognitive impairment to utilization of this test on a weekly basis. It is actually the only test that's currently available, low cost, actually free, and does not require any additional setup outside of you having a computer at home. That can be done on a weekly basis. Tests like MOCA and other tests, as you'll see, have a lot of limitations. So I decided to make this video. And if you are not one of our GW Center for Integrative Medicine patients or GW Medical Faculty Associate patients, you can still take this test at no cost, and you can contact us if you need any additional input or if you need some kind of a guidance, not just how to do the test, but also if the tests show abnormal results and you need some assistance. So what I'm going to do is I'm going to go ahead and share my screen. And I'm going to show you a couple of slides that I recently presented at the annual conference of Academic Consortium for Integrative Medicine and Health Centers. So going to get going here. So the presentation is titled Boston Cognitive Assessment, Comprehensive Self-Administered at-Home Test for Longitudinal Tracking of Cognitive Performance. After I walk you through the slides, I'm also going to share the screen, and I'll show you actually how the test is done in real life so you can have a better sense. And again, the incentive here is I really want everybody to feel comfortable to be able to set up process going forward, but also to be able to do everything at home on your own. Well, you all know the epidemiology of Alzheimer's disease. It's a big problem. It's getting worse. We really can't prevent the disease, but we have to start very early. One of the big problems right now is that even though everybody is saying this is the Lancet Commissions, which is probably the #1 international authority on this particular issue, is basically saying about a third of all the cases of dementia might be theoretically preventable, and our own CDC is in agreement with this. The head of CDC a couple of years ago made the same exact statement. But again, there's a big part of the problem is basically we don't really have a low cost or free direct-to-consumer cognitive assessments that can be done very frequently. There are several tests that are currently available. So the MOCA test is one, which is a standard. You cannot do it without practitioners, so you have to go see a doctor or some other provider who will be able to administer this test. And of course, it takes time. And if this practitioner is not participating with your insurance, it's going to be quite expensive. And also, this test is not supposed to be done more than every 3 months. And then there's a problem there. If you're trying to use cognitive assessment as a way of preventing cognitive decline, not as the way to literally treat an already existing problem, the MOCA test is not the right test. It's not set up to do that. And similarly, the MMSE or mini mental screen exam, which is no longer actually used as much because of some issues with copyright. It's an older test. And also SLU or St. Louis assessment. So that is very similar to MOCA, less commonly used, but the same problems as MOCA. So what's left here, which is currently in heavy use, is something called CNS Vitals, which we also use in our RECODE program through the Apollo. However, the problem with this test is that it's paid and it's pretty long and it's kind of complicated. So you really don't want to do this test more than once a month. And also, if you're not a RECODE patient and you're not signed up for the program, you have to find a practitioner who either going to bill you for this test, or if they take your insurance, then they can bill insurance. But you know, it's much more sophisticated. So the reason we decided to do the BOCA is to kind of bypass all these issues at once. So BOCA is direct to consumer. We already had I think I already had 2 YouTube videos on this test. So this is serves as a more specific update. And each test is unique and randomly generated. This is a very big advantage compared to a MOCA. Otherwise, it's kind of similar to MOCA in the way it's administered and in the way its domains of testing are set up. And then the result can be immediately uploaded into EMR and can be kept HIPAA compliant. And I'll show you how that's done in real life. So this is the actual publication that we did last year in the BMC Neurology. And I'm going to show you actual administration of the test in a little bit. This is a copy of what I did just a couple of days ago. And so you'll see how it actually is done. The results of our study was we compared the BOCA to MOCA. MOCA is currently considered by most the gold standard test for cognitive assessment. As you can see, the MOCA performed really well. It's very highly consistent with the results of BOCA test. And one of the critical aspects of BOCA, you really cannot entrain yourself in it. So meaning each test you're going to do, your system, your cognitive, your capacity to get the score will be independent on the test before. Versus with MOCA, you can take multiple tests and eventually get better and better at it, not necessarily because your memory is improving, but because you're basically in training yourself to do better on the test. So in essence, it's a test taking capacity. It's not an actual assessment of your capacity. So you can see it with BOCA, that's really not happening. There's only one patient who slightly went up over time and one patient went down, but everybody else, this is a short administration time, was very stable, which is what you want to see. And with that, what I'm going to do is I'm going to end the slides and I'm going to take us to the actual BOCA website. And we're going to go ahead and administer the test to myself. So I'm just going to show you. So this is, the website is bellcurveandme.com. Of course, I'll put that in the description of this video. And then you'll have to click on this. Now it will ask you, now I'm already in the account. So I'm signed in account as individual. You can do that. And also if you are part of our clinic, you can request and we will add you to our clinic as a part of our clinic. That does two things. First of all, we'll always be able to see your results on our end. You don't even have to send us results, they'll be on our end. And two is not only is it all HIPAA compliant, it's kind of an optimizes the back and forth. Previously, before the system was available, patients would send us results. We'd have to manually put it in a charm in our EMR. Now that's all getting cut out. For now, this system is not linked directly into our EMR yet, but it will probably happen in the future. But meantime, it's not even that essential because we on our end can see all of you inside the Bell Curve and Me portal. So I'm going to get started and so you guys can see how this all gets done. Sorry, excuse me. So it'll ask you to do the sound check.
This test uses audio instructions. If you can clearly hear this message, click the number 1.
Okay, so there's no paper used. It's all online. I'm not going to do the whole test. I'm going to run through probably 2 or 3 sections, just maybe 5 minutes in total, just to give you a flavor what it looks like.
Please memorize these 5 animals until the end of the test. Cat, shark, turtle, dinosaur, pigeon. Select the 5 animals you have heard.
All right, let's see if I remember. Cat, shark, pigeon, turtle. I don't remember the 5th one. Okay, so yeah, that happens. Oh, dinosaur, right? Okay. So this is correct. The system will, I think it will tell you. So
select the green circle.
Okay. Instructions at the bottom, and it'll tell you whether it's correct or not. Now this
select
is the actual
the red circle.
This is the actual test already. Looks easy, gets a little difficult, more difficult as you go.
Select the small red square. Select the square on top of the circle.
Square on top of the circle. Okay. All right, I'll do a couple more and then we'll stop.
If the boy is made fun of by the girl, who is the bully?
If the boy made fun of the girl, who is the bully? Boy. Oh, incorrect. Whatever. I don't.
The girl is slower than the boy. The monkey is slower than the girl. Who is the fastest? Which object, when rotated, is identical to the object on top?
So this is getting harder. So it would be this one.
Which object, when rotated, is identical to the object on top? Which object, when rotated, is identical to the object on top?
Okay, so I'm gonna stop here because the test will keep going.
Which object, when rotated, is identical to the object on top?
This is the last one I'll do. All right, so okay, so you can quit whenever you want. Are you sure? Yes. Okay. So, and then it'll tell me to finish it later if I. So actually, you can. So you can actually leave, come back, and finish the test. It's a very nice kind of an option here. I'll do it later. Okay, so that's it in terms of what I wanted to show you. And one thing I'm not showing you is actually there's a capacity to track the data so you can see exactly how you've been performing, which in a big component, we do see some fluctuations in cognition, especially, so right now I'm doing this video at, let's say, 1 p.m. But if I were to have some cognitive concerns, its chances are that my 9 or 10 a.m. test would be better than the one at 5 or 6 p.m. It's called, the effect is called sundowning. It's very common in Alzheimer's disease. And so you want to capture the best performance and you want to make sure you're minimizing the fluctuations of it. And so the test, every time you do it, will record when exactly you did it during the day, and you can see all of that fluctuations. And then if you discuss it with your provider, your physician, let's say, that all can be reviewed as part of the visit once all the results are there. So with that, I'm going to go ahead and end this video. Thank you very much. As always, you will have the details of the test, needed links, etc., in the description of the YouTube video. Have a good week, good day. Take care.